All right, everybody, let's get ready for some helicals now. RNA viruses that are helical and with their nucleocapsid shape. Before we begin, most importantly, if you have not learned anything else by now, no, I'm just kidding, honestly. But joeyjohnsondo.com, if you will go to that website, joeyjohnsondo.com, go to the tab for donations and click on the PayPal link and donate your $3 if you have not done so yet. Thank you. All right. So I told you guys about the way we were breaking everything down, that we had the icosahedrals and we went to whether they were enveloped or non-enveloped, and then we were going to the helicals and going to whether they are non-segmented or whether they are segmented. So today we will do the RNA helicals that are non-segmented. Okay, you don't have to worry about envelope for these because you know why? All of the RNA viruses that are non-enveloped are going to be icosahedrals. Okay, so there are those icosahedral groups that we went over in the RNA viruses. Any other icosahedrals are all going to be enveloped. And so any other RNA viruses, period, for these helicals are all going to be enveloped. So we've already done all the non-enveloped. I told you that's the reason we're breaking everything up this way. Now, when it comes to segmentation, all of your segmented RNA viruses are all going to be helical. All right, there's only one exception, and that is the Rheoviridae family, if you remember, okay, from the icosahedral non-envelope form. So that's the reason we broke them up this way. Makes it a little easier, okay? Coronaviridae, right over here, okay? So that's about 15% of all colds. Remember, rhinovirus is about 50% of all colds. Coronaviridae, or coronavirus, is going to be transmitted through respiratory secretions. It's going to bind to your ACE2. So I'll just draw that right there, of your upper respiratory tract. The diseases it causes are common cold and SARS. Now, this is the big one. This is sometimes seen as a biochemical possibility for warfare. You know, you have tularemia, you have anthrax, and you have the SARS form of the coronavirus as well. You might get a non-productive cough with this, with dyspnea and hypoxia. It can lead to respiratory failure. Something else you're going to see here, though, are big patchy infiltrates on the chest x-ray, okay? Patchy infiltrates. You have a 6 to 7 day just normal common cold with this. And the SARS, by the way, stands for Severe Acute Respiratory Syndrome. Something else you'll see with this is a very high fever. And you have constitutional stuff like myalgia, malaise, breathing difficulties. And the onset is typically within about 10 days of exposure. So you get exposed, within 10 days you have a cold or something, you know, and that will last for about 6 to 7 days. So now let's go over here to Ebola Marburg, okay? Ebola Marburg, notice this is in your Filoviridae right there, and this is the main one you're going to worry about. It has a shepherd's hook appearance. So this one is going to have the shepherd hook's appearance, as I was saying. So it kind of looks like that right there. And it's a long filamentous RNA virus with a helical nucleocapsid, because all of these are helical, of course. Monkeys are reservoirs for this, and it's spread to humans via bites or body fluids. And so it's transmitted that way, and it's endemic in Africa. It can cause hemorrhagic fever, so it's one of those, all right? Causes flu symptoms followed by bleeding, and you're going to make sure that you quarantine this. They're still trying to figure out what the heck is going on with that, of course. Let's talk about hemorrhagic fevers for a little bit, all right? What are the viruses that can cause hemorrhagic fevers? All right, so the mnemonic I remember is you held blood. Okay, you held blood, and so that's the mnemonic for this one. Okay, the Y is for yellow fever. That's a flavivirus, of course. The H is for a hantavirus. It's a bunya virus. The E is for Ebola Marburg, which is a Filoviridae. And the L is for Lassa virus, which is an arenavirus. That's going to cause hemorrhagic fever with renal failure. We'll get to that in a little bit. And then the D is for a dengue virus. Remember Flava Flav? Dang, you fine, girl. So those are the ones that are going to cause hemorrhagic fever. So, all right. Sorry, got ahead of myself right there. Let's go to rabies now. So that's in Rhabdoviridae. As you can see, it's bullet-shaped, and it's intracellular. It has intracellular stuff called negri bodies that are going to be intracellular inclusions inside of the neuron body. Remember, other intracellulars would be like CMV or chlamydia. This one's going to have the negri bodies, and so it's transmitted by bites by wild animals, or some people say through also scratch with saliva getting in there. Like raccoons, skunks, and bats are going to be your top animals you're thinking of as reservoirs for this. That negri bodies are endositized into the CNS, and travels up, can cause encephalitis. You're going to have hydrophobia with this, seizures, progressive encephalitis with salivation, painful pharyngitis, and painful swallowing, okay? And so this has a very long incubation period, so that makes post-exposure protection possible. If you have, you expect pre-exposure to rabies, then what you're going to want to do is go ahead and give someone the HDCV vaccine. But if they are post-exposure, like I said, it has a long incubation period, you're going to cleanse the wound. After cleansing the wound, then you'll give them HDCV plus HRIG, but that's only after cleansing the wound from which, they were infected with rabies or suspected infection. All right, so Paramyxovirus, all right, this, as you can tell right here, you're going to have your MMR, but it's not measles, mumps, and rubella like the shot that you get. It is measles, mumps, and RSV, okay? And then we paramix it up with the Paramyxovirus as well. Measles is going to be also known as Rubiola. Let's get that straight very quickly, okay? Rubiola is measles, all right? Rubella, remember, was a toga virus, okay? Sometimes you might see the rubulo virus, which is mumps, all right? And so you just got to kind of get those, okay? This is measles, as you can see. Rubella virus is going to be mumps. Rubella is its own thing, okay? So the measles are also a morbilliform virus, as you see right there, because of the way that all of the maculopapular rashes will coagulate together and kind of morbilate, become morbilliform. It typically is going to be above the clavicles and the shoulder for that, all right? All paramyxoviruses are going to contain something called the F protein. Now, the F protein is going to stand for fusion, okay? And what that does is it's typically going to take epithelial cells and make them form into multinucleated cells called syncytia, okay? And so that's the reason why we have respiratory syncytial virus, because it's going to cause them to syncytiate or all clump together to coagulate and form giant cells, okay? A lot of times you'll have the macrophages involved, all of that stuff will coagulate and clump together, and then it can go on to make granuloma, all right? So going on into this, the most common respiratory infections in kids, all right, is going to be these paramyxovirus things right here. So let's start with parainfluenza, because it's not the one that's in the MMRV mnemonic we talked about. So, I mean, not MMRV, excuse me, MMRSV. The RSV is for the R part. All right, so parainfluenza, you're going to have the croup, the barking seal cough that they talk about. It's transmitted through aerosols. It is going to cause acute bronchitis in kids under 5. So that's acute laryngotracheobronchitis. Okay, so it affects the bronchioles, the trachea, and the larynx. Okay, and it causes that harsh barking sounds like a seal, and it has a high-pitched cough. It has an inspiratory stridor also with hoarseness involved in it. All right, and it may cause a common cold as well. There's not really a vaccine against that, so just know that. While we're talking about non-productive coughing, they're usually viruses, and you can get that from like RSV, influenza, parainfluenza, corona can cause it as well. So, you just want to be on the lookout for that versus something that's productive like salmon-colored. Remember we talked about that, or rust-colored like the strep pneumo, the different color sputums, the current jelly-like for Klebsiella. So let's go on to morbillivirus now for rubiola, known as measles or 7-day measles. So you're going to have the 3 C's that occurs with that. So that's going to be your cough, conjunctivitis, and coryza. Coryza is going to be the stuffy nose. Sometimes it has like a little trickle of running or something, but that's what coryza is. And so you're going to get that prodrome, the coughing, conjunctivitis, and coryza. And so the way I think about it is, since it is the 7-day measles, because 3-day measles is the German measles, which is rubella, this is true or hard measles, known as the 7-day measles. Think about a 3-day prodrome. That'll help you remember the 3 C's. And then days 4 through 7 is when the rash is going to appear. Okay. So also on the 4th day, you could think of kind of the 4th C. It's not really a C. It starts with a K. It's called Koplik spots, but you can think of it because it has that K sound to it. All right. This is going to be kind of patchy, whitish, grayish blue spots inside the mouth in the buccal region. So you have your 3 C's on the first 3 days, Koplik on the 4th day, and then the rest of the time you're going to get the rash. That's how I kind of think about it. The rash presents after everything else has occurred, typically on the 4th to 7th day, ironically, and it spreads from head down, including hands and feet, but not the palms and soles. Remember us distinguishing that, okay, in one of the earlier lectures. You're going to get flu-like symptoms. You're going to have a very high fever, and you're going to have photophobia here. You'll have a confluence, like I said, the morbilliform of the patches that occurs above the clavicles and shoulders. You can get encephalitis from this. Giant cells with inclusion bodies, because as you see, it is one of your Paramyxoviruses, has the F protein there. And so I think that's probably going to take care of that. Of course, you have the MMR shot that you get, which is measles, mumps, and rubella. It is live attenuated vaccines that infants get greater than 15 months, and you get boosters throughout your life for that. Let's go to the Rubella virus, which is mumps. So Rubella virus, the mnemonic I like to think about this with mumps is, what do mumps do to you? They make your jaws pop out, right? Okay, so since they make your jaws pop out, I remember this, okay, because you have parotitis of your parotid glands. By the way, what innervates your parotid glands? You know? It's not cranial nerve 7. Cranial nerve 7 will actually go through your parotid glands and then dissect into different regions that it innervates. The cranial nerve 9 will actually innervate the parotid glands. So just a little anatomy tie in there. All right, and so then you're going to get orchitis, I think, in about 10% of individuals. You can also get ovitis for the females. And you're going to get, let's see, so you have parotitis, you have orchitis. This is one that can cause the aseptic meningitis. Don't forget, we talked about that, the amped up ones that can do that. And so you're also going to get pancreatitis. Okay, they make your jaws pop out, and you can remember that mnemonic right there for what all's involved with mumps. The orchitis can cause sterility if bilateral, and so if you have a person who is, say, 12 or 13, a male, who gets infected with mumps, you're worried about sterility. And so this is transmitted through aerosol droplets. You have the MMR vaccine, measles, mumps, rubella. It has a low-grade fever and headache and malaise associated with it. Sometimes you'll get an earache as kind of a sort of prodrome before you actually get the parotitis that comes along with it. And this is one of those, too, that you get lifelong immunity from. So once you get, infected with it, then you kind of have lifelong immunity against it. The same also occurs with rotavirus and rubella. All right, so rotavirus, rubella, and mumps, you will typically get lifelong immunity from once you get infected. Now, RSV, all right, respiratory syncytial virus is transmitted through hand contact, aerosols, and hospitalized infants. It causes bronchiolitis and pneumonia. And it's like the most common cause, I think, of bronchiolitis and pneumonia for infants, if I'm not mistaken. Don't hold me to that, but I'm pretty sure it is. Kids can also get otitis media. Adults can get common cold from this. And so you're going to diagnose this through immunofluorescence or through a rapid antigen test. You're going to look for those multinucleated giant cells, the syncytia, clumping together, which is usually several, like I talked about, macrophages all forming, and then they can turn into a granuloma. And so you're going to treat this with ribavirin. That's going to be the drug of choice, all right? So R for ribavirin, I think I spelled that right. But you can also prevent against it with this drug right here. I always say it wrong, so I am just going to, let's say it's Vali, and then it's Vizumab. Okay, you can protect against that because that is going to actually be your anti-fusion protein right there. And so I always think, pal, is you mad because I just blocked you from copulating? Okay, because, you think of stuff getting together, it's copulating, all right? So you have pal, and then I say, is you mad? Like kind of mad, because I just blocked you from copulating. Yeah, I just did a block on you. So anyway, so that's what you're going to prevent against, okay? Since it's respiratory syncytial virus. And that is it for our RNA Helical non-segmented. So I hope you guys enjoyed it. And, oh, yeah, one more thing. It's not a virus, but it is $3 that I'm asking for, okay? $3. JoeyJohnsonDO.com. Go to the Donate tab. I appreciate it. See you next time.